A little differently on focus on the bottom line and allow the media to share most of the detailed demographics later with you. Ladies and gentlemen, very simply, as you are now aware, Kenya is facing another surge of COVID-19, one that is not only varying from what we previously faced, but a wave that is more aggressive, non-discriminatory strain, attacking everyone from infants and those with no known comorbidities to those that are elderly and otherwise vulnerable. Fellow Kenyans, over the last few days, we have seen our positivity rate rise with a vengeance that we have not witnessed before. And as we speak, we are now confirming over 17% yesterday of those tested as positive. And once again today, some 1,279 persons out of a sample size of 7,450 have again tested positive. This means that once again, our positivity rate today is once again 17%. Unlike before, where virtually all our infections were asymptomatic, we are now also seeing a steady increase in hospitalizations, with ICU cases climbing to over 100 over the last 1 week from a low of 30 just 2 months ago. The spike has not stopped there. In the same period, since mid-January, we have lost over an additional 200 individuals to COVID-19. Our frontliners have remained steadfast in their commitment to serve the COVID-19 task forces at work and at the National Emergency Response Committee, and indeed the government of Kenya is unwavering in its zeal to protect the public. Yet, I cannot underscore the importance of our compliance with the protocol spelled out by His Excellency President Uhuru Kenyatta this past week, as guided by our medical experts. With the pandemic spreading nationwide, with the surge affecting more of us, and with the health as a devout function, it is important that I remind us that the President has directed many measures, but amongst them, the following stand out, and I wish to propose as follows. That counties convene immediately the county task forces to assess the containment measures of the virus in their region and the availability of piped and portable oxygen. From our records, we do have some counties that fall short in this area. That counties open all isolation facilities in preparedness for immediate use. That counties enforce all public health measures and penalize those facilities that are flouting the rules. We are aware, for example, that there are counties that are about to close markets where people are not utilizing or following the rules in terms of use of masks, and as well as provision of sanitizers and water. It is important that we do this. Law enforcement agencies were directed by the HE, by the President, to ensure that observation of the directives guiding social events, so there is no feasting at funerals, and that family members do not exceed 100. As you are all aware, There has been incidences over the last few days where people have lost their lives when they are attending funerals. And there is really no need for us to go to funerals, only for those funerals to be followed by other funerals of the same friends who are there to say goodbye to a loved one. And clearly, I'm sure the media is aware, it's been there in the papers, and it is one of the areas, funerals were some of the areas, and that's why the ministry gave directive that all funerals must happen within 72 hours. Now, let it be clear, we are not talking about COVID funerals. We are not talking about COVID-infected persons. It is all funerals in the country must be carried out within 72 hours. And funeral homes are supposed to adhere and make sure and advise families that this is what must happen. Now, we obviously regret any inconveniences that this is going to cause, but I'm sure you will all agree with me that this is a necessity. Talking about enforcement agencies, I think you also remember that the President ordered that at the county level, the creation of enforcement agencies and the work of these enforcement agencies that are led strictly by GAO, the governors. We will also include in those enforcement agencies the religious representatives. But I think the important thing to remember here is that the purpose of the enforcement agencies is to ensure that there are no entertainment facilities that are continuing past the hour. There is no gathering anywhere in the counties. It is to ensure transparency as far as the closure past curfew is concerned, because there were accusations that there are some people in positions of influence who are influencing so that past curfew there were some joints that were remaining open because the owners are known. The idea of a committee serving as an enforcement agency is to ensure that no such favoritism is seen in the counties for any activity. May it be the opening of pubs, may it be funerals, may it be entertainment areas. I think it should just be made clear that the emphasis on enforcement is going to be made stronger going forward. The committee, the task force, the healthcare task force here, led by the chair, Eva Jenga, has been tasked with ensuring that home-based isolation and home-based care for COVID-19 positive cases, the management is enhanced for the same. And the reason why this is very important is because moving forward, we are also, because of how stretched the facilities are in the main hospitals, we are going to really emphasize on home-based isolation and home-based care. Those who do not need oxygen, those who do not need ventilators, will have to be looked after at home. And this means that those of us who are operating freely must be very, very careful, because when you know that you have to be taken care of at home, where your children are, where your family is, then it behoves you to ensure that you stay safe. Because if you don't need oxygen, if you don't need ventilators, it is going to get to a time where you will have to be looked after at home if the trend that is there currently continues. This means also that as a ministry, we take the responsibility of ensuring that our healthcare workers have increased their ability to move, the mobility of the healthcare workers supervising isolation, people in isolation, including the provision of more ambulances, the provision of more personnel, so that they can be able to supervise and move around as quickly as possible. But I think the import of this is just to say that in our own homes, we should now prepare. We should now be prepared to host our family members who may be infected by this virus, provided they are not, they don't need hospitalization. For this reason, we are also urging our hospitals to quickly expand our ICU facilities and to the greatest extent possible, redeploy some of the resources we have so that we can be able to fight against COVID-19. Again, the task force has been asked to identify areas that can be converted, isolation facilities that we can quickly convert into ICU facilities. This is because if you look at the first two waves, the necessity, the need for ICU facilities did not rise up as high as this third wave is exhibiting, and therefore we need to prepare more ICU facilities in the country, and we need to do so at each county, because moving forward, just like was happening round about the second wave, moving forward it is very likely that counties will have to take care of their own patients at the county level, because Nairobi County has got a large population and is already beginning to feel the stress of having more patients than most of the hospitals are able to. This is at a time when a lot of county ICUs are still empty. So we are urging that people use county facilities rather than everybody rushing to Nairobi. Therefore, fellow Kenyans, what the government is demanding is cooperation and responsible behavior. It is seeking your partnership in this fight, because as we have maintained from the onset, in this cycle of life, our actions and agility shall determine how fast we sink or swim. As an intertwined people, there is the adage, if you want to go fast, go alone, but if you want to go far, go together. As we can do it, as we have done it, I urge Kenyans to quickly revamp our resolve, to quickly determine to fight this wave, this new one, just like we did the last two. Now, I appreciate, and we in the Ministry of Health appreciate, that we are tired, we are stressed, we have been pushed sometimes to the limit by this virus. But I must tell you and urge you, I must ask you, that this is not the time to tire. This is the time instead to invigorate ourselves, our determination, so that we don't fall on the wayside. The disease does not know that we are tired. The virus does not understand that we are tired. The virus is just ready to demolish us. Let us not allow it to do so. And since I know that there are those who see a contradiction between increased containment and vaccination, let me state that getting a jab does not mean relaxing in our wearing masks, sanitizing, or social distancing. In fact, the opposite is true. Until we have sufficiently inoculated the entire population and created herd immunity, we will remain at risk. I'm very encouraged by the feedback we are receiving from the counties on the uptake of the vaccine, and wish to encourage all those that are eligible for this phase to avail themselves for vaccination, even as we work tirelessly to sustain supply. So far, we have vaccinated a total of nearly 20,000 people since this vaccination began last week. As we have indicated, this first phase covers frontline workers, who have included health workers, teachers, security, and religious instructors. For avoidance of doubt, the religious instructors include members of the clergy. Further, we have noticed that most of the deaths are in persons aged 60 years and above and with underlying medical conditions. This being the case, we have prioritized them as well to be part of Phase 1 rollout plan once the second consignment of vaccine is delivered next month. Fellow Kenyans, I am praying that as a result of your cooperation, we will begin to see decrease in numbers of admissions that we are seeing now. And of course, we wish to overcome this menace. But I'm sure there will be those who will want to know a little bit more about vaccines. And I want to urge Kenyans to be patient with some of the things that we have started. The rollout of the vaccine, and I'm going to ask Dr. Willis Akwale, who shares the task force on the rollout of the vaccine, to say a few things and to respond to some of the questions that you might ask as far as vaccine is concerned. But I want to emphasize the following. I want to emphasize that first, we need total and complete transparency about the rolling out of the vaccines. Secondly, I want to also state that we want to move at a pace that is manageable, a pace that is fast enough to capture what we want, but a pace that also does not develop chaos. The rollout includes institutions and training. And so far, we'll give you the figures of the numbers trained from the first day that we had the 200 or so to where we are now. We will give you the record of the persons who are being vaccinated, because don't forget, each person we are vaccinating now will need a second dose. So there has to be the specific name of the specific person, so that when we come back to the second dose, there is no confusion in the scheme of things. So I want to urge that I know there is some impatience in rolling out, and I know there is some impatience in those who want to be vaccinated as quickly as possible, and that's our aim. But I think that we need to move at a pace that we can control. This is going to develop exponentially. You start with 2, you go to 4, and of course, as you train people, when you train 200 people who then train others, we grow exponentially. Therefore, we started at a time when we were doing 100 per day, and now we are doing almost 4,000 per day. We'll move to 5,000 per day, and eventually scale up to figures that are going to be impressive. But right now, we need patience from fellow Kenyans. So without much ado, before I take questions, I want to ask Dr. Willis Akwale to say make a few remarks, and then we can begin to take 1 or 2 questions. Please, Dr. Akwale.
Thank you very much, Cabinet Secretary, distinguished ladies and gentlemen. Mine is to really say that the vaccination program, the rollout program, has started off to a very good start. You remember we received the vaccines on Wednesday the 3rd, and by actually 5th, distribution to all regional centers had been undertaken. In fact, by 6th, even Mandera already had the vaccines. And by 8th, which is like our week 1 of the vaccination, counties started collecting their respective allocated doses. And by the Wednesday of that week, which was 10th, 23 counties had started vaccinations. And by end of last week, Friday, 40 had. But as we speak today, all counties are now vaccinating and reporting into our digital platform. So when we shared the data of 9,000, that was actually 3 days of vaccination mainly, the Wednesday, Thursday, and Friday. And when I heard people saying there's hesitancy, I was taken aback as to how you can measure hesitancy within 2 days or 3 days. That would be very poor science. It is measured over a period of adequate time, because our Phase 1 goes up to June. And for us, we want to measure uptake by week until we are able to cover the 125 million people we targeted. and I am sure we are going to surpass that. So I would also want to say during the first week, we were only using 47 public health facilities whom we had trained and equipped, and they therefore did a commendable job. Last Friday, we released a list of 622 facilities, both public, private, including NGO and mission hospitals, and all of these are now lined up for training. Upon training, they will also be trained on the use of our digital platform we are calling Chanjo KE, because that is what is going to be used to track the vaccine and the vaccinees. We must know which vaccine has been issued to you, the batch number, when are you supposed to come back. And we've insisted even for the private sector, you will not be given the vaccines until you report through that particular system. And this is the data that we'll be updating you on a daily basis, especially beginning from next week. So I wanted to point that because this week and most of next week, you'll start seeing the numbers increasing. And the purpose of ensuring we use 622 is to ensure access and equity. If you look at the list, it is spread across the entire country. So in terms of therefore the uptake, that is good. And as you hear what the Cabinet Secretary has said today, we have decided that clergy who are described also as instructors, they are frontline healthcare workers, will be vaccinated. He has also made it clear that people above 60 years with underlying health conditions are the majority of the deaths, almost 2/3 of the deaths. So in the next consignment, they'll be brought forward into phase 1 and be prioritized. Now let me address the second issue of safety. There have been a lot of reports about the AstraZeneca vaccine and suspension of vaccination programs, especially in Europe. And this has caused anxiety, but I want to assure Kenyans that there's no cause for alarm. When a health product is under what you call emergency use authorization, if you suspect a severe adverse event, once it is reported, you investigate that event. You suspend, and if you cannot show direct linkage to the product, in this case being the vaccine, then it is allowed that you continue with the vaccination program. And as you can see in Europe, a number of countries have started. Now in Europe and AstraZeneca globally, 17 million doses have been distributed and 41 events with clots have been reported, but none has been shown to have been caused by the vaccine. Here in Africa, AstraZeneca, 850,000 doses have been distributed, 1,110 cases have been reported, but only 5 have warranted an investigation. Since we began here in Kenya, the 20,000 cases, the Pharmacy and Poisons Board is the regulator, is the one that monitors adverse events. And it reports to a committee known as the Kenya National Vaccine Safety Advisory Committee, chaired by Professor Ezekiel Were of the University of Nairobi. And any case that is reported, if it warrants investigations, they go through that and they will advise the country. So for us in Kenya, the position is this. Both the European Medicines Agency, which is the regulator for AstraZeneca in Europe, and the World Health Organization that gave emergency use authorization under the COVAX mechanism, will stand by their advice. But we will also keep monitoring what is happening in our country through an active surveillance by the Pharmacy Board and both what we call spontaneous, where people report if they have any side event, and also an active one where we go to determine if there are any unreported cases. So in brief, we have a very robust safety monitoring, and we will be investigating, and if there's any reason as to why we may need to suspend and do investigation, then that will happen. I want to assure Kenyans we have a very dedicated team, and the Safety Advisory Committee We review reports both from WHO and our own local reports. My sister here, I think, has told me we have 19, is it 19? How many reports have been reported? 40, but none of them is serious to warrant an investigation. Majority of them are headache, a bit of muscle pain, and fever. So that is what we have. Really, I can assure you, we are on a good start, and there should be no worry about AstraZeneca. If you go and look at data in terms of reduction in severe disease and hospitalization and deaths, all the vaccines under the COVAX mechanism were 100%. They reduced that, and that's what we need to save. We need to reduce the number of people going to hospitals. We need to save lives, and that's what the vaccine is doing. And therefore, really calling upon everybody, this is the opportunity. The government has put in a lot of effort to ensure that this vaccine is available for you to make that decision. Thank you, CS.
Thank you very much. At this point, I would like to then ask if there are any questions so that we can be able to respond. When you do ask, as usual, you identify yourself and then say specifically to whom you need to, whom you're addressing the question to.
Raquel Mugai, Citizen TV, to you as a. The healthcare workers met with the Senate Health Committee earlier today, and they pointed out that there was no clear policy that was issued to them on how the ministry is going to look at adverse effects management in case any side effects arise that will warrant healthcare management. So what is your comment on that?
My name is Kenna from People Daily. On the issue of the third wave, what has spiked it? What is the cause? Because I saw you mentioned funerals, you mentioned bars, but you didn't mention political rallies. I don't know.
Okay, we can take those first then, if you don't mind. I think I will yield the first question once again to Dr. Willie Zakwale about the side effects and so on, because the side effects will not just be for health workers. It is for everybody. We are infecting it, we are vaccinate across the board. Okay. So I think that the issue of what plans are there, I think that is the docs are better at that than I am. On the issue of the third wave and the reasons, I think it is very clear, and I apologize indeed. If I left out political rallies, I want to apologize, because political rallies are part of the ways of spreading this virus. There is no escaping that responsibility. And that is why we said that that is why the president was very emphatic about the fact that there will be no political rallies until further notice, and he gave the dates thereof. And I want to say that the enforcement agencies, through the directive by the president, were essentially ordered. They were ordered not to relent as far as the stoppage of any political rallies is concerned. And therefore, I think to your question, it is any gathering, may it be a church, may it be a political rally, may it be a mosque that is not observing the rules. And I'm aware that some of the temples, in fact, I think there was a circular that the temples, the leaders of the temples have closed them. I saw that circular from them. And as we move on ahead, we will take any other measures that we feel are necessary to contain the spread of the virus. So it's the political rallies and any other measures that we can take or that we have to take in order to protect Kenyans at large. I don't know whether Dr. Kuria, you want to add anything about the other reasons why, not just in Kenya but globally, there has been a surge in the third wave, because it did not just happen in Kenya. Maybe Kuria, you can allude some light on that as well.
Well, thank you, CS, for that, and thank you, Kenya, for that inquiry or comment. And indeed, CS,
I think you need to speak up.
the issue of political rallies, we've dealt with it quite well. It has been pointed out by many Kenyans as a major cause for the surge we have today. But as you rightly put it in your earlier address, that Kenyans and the Ministry of Health also, we are all tired. And I think the general populace is more tired than the Ministry of Health, maybe. And if you go around the country and how we are adhering to the containment measures, it tells a story of why the surge is happening. In our country and walking around the up-country, all the functions that are happening, the burials, the wedding ceremonies, the occupancies in our pubs, is as though COVID happened in 1916. So we went back to the practices we had before COVID. So when we say that political rallies are to blame, yes, we also have to blame ourselves, not just the political rallies. We as an individual, I as an individual, you as an individual, are also to blame for the surge. So that's why the CS has urged all of us to be responsible. One key important factor is the wearing of the mask. We've many a times talked about the proper wearing of the mask. And walking around the country, you can see where the mask is being worn for those who have it at all. The up country is worse as you walk around the country and as you drive across the country. The mask has been thrown out completely. And we continue urging all, if we are to fight this third wave, in the Director of Public Health, the use of the mask is going to be key in this fight. So urging all Kenyans to go back to those controls that we advised earlier on, and we're going to fight it all together. Globally, there has of course been the new variants that have been ravaging the globe. You are aware of the UK variant, the South African variant, and Kenya has not been safe, of course, from some of these variants. We have, of course, put in place certain mechanisms to monitor these variants in the country, but they may also be blamed, and as we do more genomic surveillance, you need to advise on their role in this current surge. So yes, globally, the new variants are responsible sometimes in places, but the new surge, it has been thought to be more transmissible and causing more severe disease in some instances. So it cannot be said it is that alone, but yes, it could be part and parcel of this new surge in the country. Thank you, sis.
Maybe Dr. Akwale, you can respond to the issue of, I think there was a question on the issue of what to do when there is some side effects. I think that was a question.
Yes, and really, thank you, CS, for that. Just to say the health workers have been trained on what to do. We are riding on what we call our pharmacovigilance system established by the Pharmacy and Poisons Board. And my sister here will briefly tell you how it works. And the health workers, and I was in one of the trainings, and I know some of you came to even cover it, they were taken through monitoring severe events. And one of the basic ones is that upon vaccination, you are observed for 15 minutes. In fact, over the weekend when I wondered why are we trying to get numbers, you have to observe for 15 minutes. And if there is immediate reaction, they have even been trained on what to do. An emergency train must be available to respond to that. Now, the issue of reporting has also been done. What I want to also say, the healthcare workers is not everybody who is going to be in the vaccination program. We have recommended people directly dealing with vaccination because other programs must continue. We are urging healthcare workers to do self-learning. There's a lot of videos that we are producing. We are going to be hosting them in various platforms. You can go and understand, even without having to attend a training. This is a culture, especially with this time of COVID, we must adopt. My sister will just tell you how pharmacovigilance system works. And it didn't just begin with COVID-19. It has been in existence for a while. Christabel?
Hang on, Elizabeth, let them...
So my name is Christabel Haemba from Pharmacy and Poisons Board, the Pharmacovigilance Department. So just to add on what Dr. Akwali has said, before the vaccines were rolled out, the Pharmacy and Poisons Board, together with National Vaccines Immunization Program, was able to train the healthcare workers on how to identify, how to categorize, and report these suspected adverse events following immunization. So in Kenya, we have a robust pharmacovigilance system where we collect data in two forms. So we have the spontaneous reporting system. This one we have what we call pharmacovigilance electronic reporting system that is on our Pharmacy and Poisons Board, that is pv.pharmacyboardkenya.org. So anybody that is healthcare workers, even the members of the public, should you develop any side effects, you can actually go in and then you'll be able to report this data. So apart from that, as Dr. Akwali mentioned, so after you've been vaccinated, you'll be monitored for 15 minutes. Should there any event occur, they've been given protocols on how to manage these side effects. Should you develop the side effects once you're outside the platform, again, you're supposed to report to the healthcare worker. So once these reports reach Pharmacy and Poisons Board, together with the National Vaccines Program, we are the Secretariat of the National Vaccines Safety Advisory Committee. So we look at these reports, and if we have any serious reports, we take them to the committee where what we call causality assessment is done to ensure, to confirm if actually it is the vaccine that caused the event. So the training was done at a high level, but it is being rolled out. And once, as now more counties are vaccinating, there are plans again with Pharmacy and Poisons Board and the vaccines program to go out to the facilities to do supervision, just to be able to find out if the protocols are being followed and to do more sensitization, because it is not possible to do all the sensitization at once, and that is why it is being done in cascaded, through a cascade program. Thank you.
So clearly, all you have to tell them, if anybody wants to know the answer about how they take care of it and how they are monitoring it, you have one word, if you can remember it. Is this thing on? Yeah, if you can remember it, it is on, it's called pharmacovigilance. Thank you very much. Fair is fair.
Okay. Zainab Mohammed from TV47. I have two questions. Yesterday, the government spokesperson, Cyrus Oguna, mentioned that the exercise is moving, the vaccination exercise is moving at a very slow pace due to lack of adequate cold chain storage in some counties. So how are you going to deal with that in order for us to hit the target of 1.25 million by June? And then number two, there are categories of people who are in the first phase, but we can see in several counties that politicians and governors are getting vaccinated. What can you say about this? Thank you.
Could you repeat that question again, please, Zainabu?
Question appeal.
Yes.
Okay, we know that there are categories of people in the first phase, the doctors, the health workers, the teachers, but we are seeing in several counties that governors, politicians are getting vaccinated. So how does it work? Are some people eliminated, or are some people favored in these phases?
My name is Ruth Wamboy from KBC. My question to you is, today during a Senate Health Committee in the morning, it emerged that some health workers are being turned away from the vaccination center. What does the ministry have to say about that? Secondly, we are seeing that matatus are still flouting the COVID-19 rules. What is the government doing to address that matter? Thank you.
Okay, last one.
Helen Aurora from NTV. You mentioned that we're looking to open up more isolation centers. How soon are we looking to do this, considering some of the high schools and primary schools are being used as isolation centers? And what measures also is the ministry taking, considering we're going into an examination period and we're reporting infections among some students at this particular time?
Last one now.
Dolino Leila from KTN. Waziri, is there any surveillance of variants being observed in the country at the moment, or tracking of the variants in the country at the moment? Because the last one was last year.
Okay. Thank you. I think that that's quite a bit. Let me start with Zainabu and the issue of politicians and governors and so on being vaccinated. You know, as leaders, I think leaders are sitting between a rock and a hard place. Because on the one hand, you, the media, have said that you want to see leadership. You want to see some of the people, and it is on social media everywhere. You want to see some people being vaccinated, and on the flip side, now when we get one and vaccinate, the governor agrees that I'm going to be vaccinated just to show that the vaccine is good and the vaccine is okay, then we are hanged on the rope of favoritism. Now, Zainabu, what would you do? Honestly, if you are the governor of a county, which you are probably going to be someday, what would you do? You are being told to lead and show us that the vaccine is safe. If you don't do it, then they will say the vaccine is not safe. But if you do it, then you'll be told you are jumping the queue. So, as I said, it's between a rock and a hard place, and essentially what we say to the leadership is that, especially at the county level, make your decision. You know, decide whether you feel that you need to lead, or whether you feel that you wait your turn, and so on and so forth. So I think that since you can't answer the question yourself as to what you'd do, we have left it to the leadership in the counties to decide that. I think it is necessary really for some, at least for some, to show that we are okay. On the issue of matatos, as you are aware, the President did order that between ourselves, the Ministry of Health and the Ministry of Transport, that we get together so that we can determine how to enforce the rules that are going to make Kenyans safe. And I think that if there is another area, another dangerous area, it is that area of public transport. And I can assure you that enforcement agencies will be firm and strict, even if it means banning some of the circles away from participating in business. Because again, you are torn between, on the one hand, people cried, you know, matatu owners are telling us, please, let us continue doing business in order to save the transport sector and to ensure that people go from A to B. And that's our determined position. That is what we'd like to do as a government. But I think at the same time, you cannot say, allow us to carry people, and we ask you, carry them safely. Please, carry them safely. And you can't do it. Then at some point, you know exactly how that story will end. But then also, the matatu operators are telling us, we are insisting on people wearing masks in the matatus, and some people are just defiant. So I think at some point, as Dr. Kuria has rightly said, people need to take responsibility. Do not agree to sit next to somebody in a matatu who is not wearing a mask, because quite possibly they will kill you. Quite possibly. So I think it behoves you, you know, do not, especially when it's a child, do not allow your child, don't allow your wife, don't allow your husband to sit next to a person in a matatu who is not wearing a mask. The government can't do that for you. The Ministry of Transport can't do for you. You can do that for yourself. And if you insist, what you are going to find is that you will be an agent of behavior change. Because if everybody insisted that somebody sitting next to me must have a mask, then what is going to happen is that everybody is going to wear a mask. But if you just look at the person, pass the responsibility to the conductor, who is hanging a mask on his chin, on the neck, then we are all in trouble. So I urge you, let's take responsibility as far as that issue is concerned. On the issue of high schools and surveillance, first and foremost, I think that Dr. Akwale had mentioned about the surveillance that is ongoing, even as we speak, by our various labs. But again, I think he might have something to say. He might something to add on that. Shall I allow you first to go on this, on the issue of surveillance? There was the South African variant in December. Now we have got other variants as well. I think, is it Dr. Kuria is the one who spoke to that? Yeah. Dr. Kuria, please go.
Thank you again, CS, and that question. I think he talked about surveillance that was done sometimes last year. That was related to some samples that are collected in the coastal region. There are 14 sequences done, and there are 4 South African variants identified. Of course, there are others that were identified thereafter of travelers traveling through the southern border, who are of course returned because our surveillance system right now is such that anyone crossing into the border gets tested again before they enter the country. And should they turn positive, then we go ahead and do PCR testing, and if they are positive, again we go on for genomic sequencing, because we want to see how many of these travelers coming into the country are carrying these new variants. Of note, of course, those traveling through the southern border are mainly the South African variant. And as I said, we had about 4 reported so far and 1 that was returned at the border. We are continuing to do that. We are continuing to do that at in the coastal surveillance lab. We also had one, of course, that was reported from a sample in Nairobi that was not even no history of travel, but was reported as the UK variant. You may also be aware of some surveillance that is happening in our lab in Kisumu, where again so far we have sampled about 62 samples from travelers who are traveling from the UK, and out of this we got 44 sequences of the UK variant. This is still ongoing, and you may all be aware that sequencing capacity is fairly low. Maybe you're able to do only about 150 sequences in a week. It's a long process, but we are continuing, and I'm sure we are increasing on those labs. Our National Influenza Center has started sequencing also this week, and we are waiting a report from them. I think we have promising results that we'll be releasing very soon. So sequencing is ongoing, as well as surveillance, so that any traveler who goes into the country and develops symptoms, of course, is tested, and if turned positive, we go ahead and do genomic sequencing to identify the variant. And as we said, we want to understand whether this new wave has any relationship to this new variant, as is happening in other areas in the globe. On the issue of schools, yes, we continue doing surveillance. We have developed a surveillance system for learning institutions, which is event-based. Indeed, there is a team that is refining that. It's a joint effort between the Ministry of Health, the Ministry of Education, and the Ministry of ICT. We want to see if we can develop what we have been using as a manual system of reporting from schools and get that into a digital platform so that we can get reports right from the grassroots, from the classroom. So we'll be rolling out that system soon. The team is in Naivasha as we speak. I was there yesterday, and we are working on that. So yes, we have reported a number of cases in schools, and of course, we have instituted, using the assistance of the county government, our county disease surveillance officers, swift measures of locking down some institutions, quarantining students who are in those schools, and we have in most of the institutions managed to contain the situation in those schools. So as exams go on, we are continuing to monitor that, and we hope and wish that the exams will go uninterrupted, and as the schools close, we'll then be able to get a break and develop that system better. One, of course, is that with a widespread community transmission, what we are urging here and the measures we are putting in place are so important. If the schools were to reopen, the schools are reopening. Because if they are the emails are contribute to a surge in the community, if indeed was happening in schools. And what is in the community may again go back to the schools when you reopen schools. So any urge that all of us go into our control measures and stick to them, and very strictly. We really request this of you. Thank you, sir.
Asante, thank you. Now, on the other one or two questions that was also asked about healthcare workers being returned, being turned away from testing, that is the strangest thing I've ever heard. We are here, and we have brought the vaccines, and we have prioritized healthcare workers. So for me, I would really like to know if those people can identify themselves and say that indeed they are healthcare workers who have been turned away from testing, then what are we doing? So I would like to believe those are fake healthcare workers.
Okay.
They are not real healthcare workers. 1 second. The second issue has to do with, I think one of the things that we need to understand is this issue of the genomic sequencing. I think if there is one thing that we have also done during this period of COVID-19, it is the issue of upscaling our capacity as far as the regional, as far as our genomic sequencing is concerned. At the beginning of last year, the only institution in this entire region, because Kenya is a regional economic sequencing, genomic sequencing center, and at the beginning of last year, the only institution capable of carrying out genomic sequencing was only the Kilifi Wellcome Trust lab in Kilifi. Now, as Dr. Kuria has said, we are doing it in Kisumu, and soon starting also here in Nairobi. So if there is a silver lining to it, it's just we have built up capacity for the same. So we wanted to say something about people being turned away. Yes, I would like them to come here for a press conference and show who they are.
Okay, thank you, sir. I think this, I also got reports, and it's a misunderstanding we need to correct. We give vaccines to a hospital A, and some of them have been assuming the vaccines are for their staff. That is not the case. You've been appointed to be a vaccination post for all target groups within the phase. So we have a vaccination post here in Afya House. Maybe some of you would need to see this one. And even if you are a teacher, you come and get vaccinated here. This is not only for Afya House. So all vaccination posts, as long as you are within the phase that has been called upon, you can access the services from there. So those facilities that have been thinking these are our vaccines, that is really where the problem is, and it will need to be corrected, possibly through an issue of a circular. Then, CS, if you allow me about cold chain, I want to assure Kenyans the capacity of the cold chain in Kenya to handle COVID-19 vaccination is adequate at the moment. We are, this year we will be talking about 24 million doses. We have adequate capacity. It's only when we start getting higher than that coming, and that it could then interfere with the routine vaccination, that is when we will be expanding, especially the cold chain capacity within the counties. But at the moment, it is adequate. And you can go and see the pace at which the vaccinations are taking place. Thank you.
So I think it's clear now that either A, nobody is supposed to hold vaccines against any healthcare worker. It doesn't matter where they come from. And two is to watch out for fake healthcare workers. Thank you very much.
All right, and that concluding the end, or rather marking the end of the COVID-19 daily brief at Afya House. Health Cabinet Secretary Mutahi Kagwe updating the country on the situation right now. 1,279 new COVID-19 cases have been recorded. That's out of a sample size of 7,450. That puts the positivity rate at 17%, similar to yesterday's recordings. They've seen also an increase in hospitalization. In fact, ICU admissions climbed by more than 100 in 1 week alone. And as a result, counties have been asked to open up the isolation facilities once more to ease the pressure on local health facilities. As far as the vaccination process goes, 20,000 people have been, or about 20,000 people have been vaccinated so far. They allayed fears on the vaccination queries in terms of it causing blood clots and whatnot. And of course, Dr. Akwale, who heads the Vaccination Commission, saying they have a robust safety monitoring mechanism that people can report any complications or side effects and will be duly addressed once that is forwarded to the Ministry of Health. That's the update as of now. Of course, more coming your way at 7 p.m. and at 9 p.m. this evening. Until then, enjoy the rest of your viewing.
Viwanda vimekufa. Kumekuwa na viwanda vya plastiki, viwanda vimekufa. Kumekuwa na viwanda vya nondo, viwanda havipo. Mheshimiwa Makamu wa Rais, ni kweli viwanda hivyo vimekufa, lakini teknolojia inatuelekeza kuwa wabunifu kwa kuanzisha viwanda vingine kulingana na mahitaji. Huenda tusizalishe sabuni kwa wingi, tusizalishe plastiki kwa wingi, lakini tunaweza kuwa wabunifu kwa kuja na viwanda mbadala vitakavyoleta maendeleo kwa wananchi wetu. Ndio maana wilaya za pembezoni na hasa za vijijini tuliwataka viongozi na wananchi waongeze uzalishaji ili tuweze kuvutia uwekezaji wa mazao ya chakula, mazao ya biashara kwa kuongeza thamani na hivyo kuvutia shughuli za viwanda. Na mimi nashukuru Mheshimiwa Makamu wa Rais kwa kupeleka maji na umeme vijijini. Kumerahisisha sana uwekezaji, na tunashukuru sana serikali ya awamu ya 5 ya Dr. John Pombe Joseph Magufuli. Kwa upande wa Tanga jiji, aramu ulioiona leo Mheshimiwa Makamu wa Rais ni sehemu ndogo sana ya uwekezaji wa viwanda vinavyoendelea. Tunakuomba mwisho wa mwaka huu, ikikupendeza, na sisi tukaendelea kuwepo hapa, tutakualika uje maalum kwa ajili ya viwanda. Tunavyo viwanda vingine 8 vinakuja na vinakamilika ndani ya muda mfupi unaokuja. Mheshimiwa Makamu wa Rais, Mheshimiwa Makamu wa Rais, yako machache ambayo yamekuwa ni kero kwa wananchi wetu, na nataka niyaseme vizuri ili ujue jitihada ambazo tunazichukua. Tanga kumekuwa na migogoro ya ardhi kwa muda mrefu, na hii inatokana na Tanga kuzingirwa na kuzungukwa na mashamba mengi na makubwa ambayo yalikuwa yaendelezwi. Mheshimiwa Makamu wa Rais, kulikuwa na shamba la serikali linamilikiwa na TARIRI, ni taasisi ya umma, lakini ilikuwa inafanya shughuli za kuzalisha nyasi na kuziuza nje ya nchi. Kwa kuachwa na kutelekezwa kwa muda mrefu, shamba lile wananchi walienda kuvamia, wakajenga makazi zaidi ya nyumba 5,000 mpaka 10,000. Mheshimiwa Makamu wa Rais, serikali ilishtaki mahakamani kuwataka wananchi wabomolewe waondoke. Serikali ilishinda kupitia TARIRI, lakini sisi viongozi kwa maelekezo ya serikali, kwa upendo mkubwa alionao rais wetu Dr. John Pombe Joseph Magufuli, tulisema hapana kwa uvunjia wananchi. Tutafanya utaratibu wa kuwarasimisha, pesa ndogo atakazozilipa za kumilikishwa ndio wapewe TARIRI kwa ajili ya ukamilishaji wa umiliki wa hiyo ardhi. Mheshimiwa Makamu wa Rais, jambo hilo tunalifanyia kazi na ndio uamuzi wa serikali, na Chama cha Mapinduzi ndivyo kilivyotuelekeza na kutusimamia. Eneo la pili Mheshimiwa Makamu wa Rais ni eneo la EPZA. Liko eneo la EPZA limegawanyika kwenye maeneo mawili. La kwanza lile ambalo limelipwa fidia, lakini la pili ambalo limechukuliwa zaidi ya miaka 6 halijawahi kulipiwa fidia. Serikali ilielekeza kwa kuunda baraza la mawaziri. Mheshimiwa Rukuvi alizunguka kwa ushirikiano na waziri wa TAMISEMI na mawaziri wengine waliokuwemo kwenye ule mzunguko. Mheshimiwa Makamu wa Rais, maamuzi ya serikali kupitia baraza la mawaziri umeshafanya maamuzi, na wewe mwenyewe umetupatia maagizo kwamba yale maeneo ambayo hayakuendelezwa EPZA iliyachukua, haijalipia fidia, yarudi kwa wananchi wakafanya shughuli za maendeleo. Tunaomba Mheshimiwa Makamu wa Rais, Mchakato huu sasa ufike mwisho, wananchi tuwarudishie ardhi yao, waweze kufanya shughuli za maendeleo, kwa sababu uamuzi wa msingi umeshakwisha kufanywa kazi, bado tu hatua za kitaalamu kwa ajili ya utekelezaji. Eneo la tatu, Mheshimiwa Makamu wa Rais, ni eneo la kule ulikoenda kuweka jiwe la msingi. Tunatambua lile eneo lilikuwa ni mali ya raia mwekezaji aliyekuwa anafanya biashara ya mkonge, na serikali ikaamua kuliomba lile eneo kwa ajili ya uwekezaji, ikalikabidhi kwenye jiji letu la Tanga. Mheshimiwa Makamu wa Rais, kumekuwa na mgogoro juu ya umiliki na juu ya uendelezaji unaofanyika. Tuliunda tume. DC nilimwagiza, waziri mkuu alikuja hapa, tume imekamilisha kazi yake, ripoti wameshawasilisha. Nachotaka kuhakikishia Mheshimiwa Makamu wa Rais, mwezi wa 3 tunaenda kufanya mkutano mkubwa wa hadhara kwa wananchi wale, tujue nani ana haki, anastahili haki gani, ili wale wanaotakiwa kuendeleza eneo lile, Mheshimiwa Makamu wa Rais, waweze kuendeleza. Na swala la fidia limesemwa vizuri, hakuna shida yoyote. Waziri wa Ujenzi yuko hapa, ameshayachukua. Tuna imani jambo hili litafika mwisho na ili tuweze kupiga hatua. Nirudie tena kwa wananchi wa mkoa wa Tanga, tuendelee kutoa ushirikiano kwa viongozi wetu, tuendelee kujitokeza na kuwasikiliza viongozi wetu. Serikali ya awamu ya 5 inaongozwa na Rais Magufuli na mama yetu Samia Suluhu Hassani mwenye uchungu wa maendeleo, wanasimamia haki za watu. Na sisi Mheshimiwa Makamu wa Rais, hatuwezi kwenda kinyume na maagizo ya serikali. Tutafanya kile linalowezekana watu wenye haki waweze kupata haki zao kama ambavyo mnatuelekeza. Mheshimiwa Makamu wa Rais, nikukaribishe. Wananchi wanashauku na wewe, wanashauku ya kusikiliza, lakini kama watendaji na viongozi kwenye mkoa tuko tayari kupokea maagizo, na nataka nikuhakikishie tutayatekeleza kwa muda mfupi na kukuletea taarifa ya utekelezaji wa maagizo utakayoyatoa. Mheshimiwa Makamu wa Rais, karibu.
Tanga mko hai, mko hoi? Hai. Siusikii uhai. Hai hoi? Hai. Amko hai eh? Hongereni sana. Nakushukuru waziri mkuu wa mkoa kwa kunikaribisha niongee na umma huu uliokuweko hapa. Lakini kwanza nitambue viongozi waliopo pamoja nasi hapa, nikianza nawe Mheshimiwa mkuu wa mkoa wa Tanga, ndugu yetu Martin Shigela, lakini pia kaka yetu Henry Shekifu Dafa, mwenyekiti wa CCM mkoa huu wa Tanga, waheshimiwa ujumbe niliofuatana nao wa mawaziri na manaibu mawaziri waliopo hapa, waheshimiwa wabunge waliopo hapa, waheshimiwa wakuu wa wilaya waliopo katika mkutano huu, wazee wetu wa Tanga. Nimefurahi sana kuwaona wazee wangu. Shikamoni. Pamoja na kwamba tumewaekeni muda mrefu, lakini mmetulia, mnashirikiana nasi, tunawashukuru sana. Lakini pia nitambue uwepo wa mstahiki meya wa jiji la Tanga, ambaye nakushukuru toka asubuhi umezunguka na mimi, uwepo wa viongozi wetu wa dini, viongozi wa vyama vya siasa, wajumbe wa kamati za ulinzi na usalama mkoa na wilaya, waheshimiwa madiwani, uongozi wa halmashauri ya jiji la Tanga, ndugu zetu wanahabari, ndugu wananchi wote mliojitokeza na kuja kwenye mkutano huu, mabibi na mabwana, asalamu alaykum. Bwana asifiwe. Awali ya yote, ndugu zangu, niungane na walionitangulia kusema kumshukuru Mungu kwamba leo tuko Tanga jijini. Lakini pia nashukuru kwamba nimeweza kuja Tanga. Nilishapanga safari ya ziara Tanga siku nyingi, na kila nikitaka kuja sababu inatokea siji Tanga. Na bahati mbaya zaidi, hata wakati wa kampeni sikupangwa upande huu, nilipangwa upande mwingine, nyanda za juu kusini. Kwa hiyo Tanga, kwanza nishukuru kwamba niko nanyi hii leo, na ndio maana nikatoa siku 5 wiki nzima niko Tanga. Vinginevyo ningekuja siku mbili nikaondoka nikenda zangu. Lakini nimekaa nanyi ili niione Tanga na nijue Tanga vizuri na mambo yaliyopo Tanga. Lakini madhumuni ya kuja kwangu ni mawili. La kwanza ni kuja kuwashukuru ndugu zangu, na hili nimetumwa pia na Mheshimiwa Rais wetu, nije niwashukuru kwa kazi nzuri mlioifanya mwezi Oktoba mwaka jana, kazi ya kurudisha madarakani Chama cha Mapinduzi. Mlifanya kazi kubwa sana kwa Tanga ilivyokuwa na matokeo ya uchaguzi wa 2020. Tunawashukuru sana. Mmerekebisha mambo mengi kweli kweli, na Tanga mmetoa kura zile za kusema kwamba kwa dhati ya moyo wetu tunakupa kura zetu, nasi tunawashukuru sana. Lakini la pili lililonileta ni kuzunguka kwenye miradi ya maendeleo ili nione kinachoendelea hapa Tanga, nione utekelezaji wa ilani ya Chama cha Mapinduzi unavyoendeshwa hapa Tanga. Na nafanya hivyo kwa sababu Tanga tumelitenga kuwa ni eneo maalum, mkoa wa Tanga, eneo maalum kwa biashara, viwanda, utalii na mambo mengine ya uwekezaji. Kwa hiyo Tanga nimekuja kwa